The American Academy of Pediatrics is recommending that students return to the classroom this fall under certain guidelines that many districts have already implemented, such as distancing desks and having students and teachers wearing a face mask. Children make up less than 8% of COVID-19 positive cases across the U.S. and less than 3% of hospitalizations, according to Chief of Pediatric Care at MUSC Children's Health, Dr. Elizabeth Mack.
Young children tend to be what we are calling viral dead ends. In other words, they might come in contact with the virus, or they might have an asymptomatic or mildly symptomatic infection, but they're not wildly infectious.
Pediatricians are pushing for the return of students to the classroom as cases of child abuse and neglect have increased since March.
We've seen far more gun violence affecting children, seen far more suicide attempts, seen far more sort of behavioral disturbances and things like that.
Dr. Valerie Scott, MD at Mount Pleasant Family Practice for Roper St. Francis Healthcare, says schools provide more than education for students, including nutrition and a safe place.
There was an increase in issues with children getting abused, and there was no one to report it because they didn't go to school for the school counselors and their teachers to see that.
If a child does return to school, doctors say sanitizing high-touch surfaces around your home like counters and doorknobs is the best way to prevent the spread of germs. The AAP says policies regarding COVID-19 should constantly be reviewed by healthcare professionals, school officials, and families. Reporting in Charleston, Danielle Hensley, Count on 2.